We are thrilled by the significant progress made, having got to zero, maintaining zero, and 42 days without Ebola. It means that there is no transmission of disease taking place in Liberia, in our community, and Liberia is Ebola-free.
Well, it all started in Guinea and crossed over into Sierra Leone and Liberia to become the deadliest outbreak in history. It's been more than a year since Ebola rocked West Africa, but now Liberia has declared they have stamped it out, and neighboring countries have vowed to increase efforts to bring infections down to zero. So how did Liberia beat the disease, and what lessons can be learned from Africa after Ebola? I'm Beatrice Marshall. Welcome to Talk Africa. Now, it's been a year since the outbreak of the worst Ebola epidemic in history, which affected multiple countries in West Africa and beyond. By early April of this year, Ebola had killed 2,346 people in Guinea, 4,486 in Liberia, and 3,857 in Sierra Leone, according to the World Health Organization's latest situation report. Now, combined, the three countries had 25,791 confirmed cases. The prevalence in Guinea, where the first case of the outbreak occurred, appeared low compared to Sierra Leone and Liberia, peaking between September and December before dipping in January, then appearing to stabilize. But Guinea isn't quite out of the woods just yet. Sierra Leone, which recorded a new surge in recent weeks, experienced a steady rise in cases from May last year, hitting the peak in December before dipping again and beginning a decline in January, stretching into March. Liberia, which recorded its first case in March last year, recorded a surge in July, peaking in September before dipping again and registering another dip in October. Then it stabilized with cases quite low. Then came May 9th, and the World Health Organization declared Liberia Ebola-free. 42 days had passed since the last Ebola patient was buried. So just what is it that Liberia did right that Guinea and Sierra Leone are not doing? Well, meanwhile, in Geneva, the World Health Organization has admitted that it failed to adequately respond to the Ebola virus outbreak. So they have set up a $100 million fund in order to sufficiently prepare in case of future epidemics.
The World Health Organization said this week that it never again wants to be caught unprepared after the onslaught of the Ebola virus in West Africa. The WHO and its Director General have come under fire for being slow to respond to the epidemic. The virus hit Guinea first in December 2013, but it was not declared an international public health emergency until almost a year later in August 2014. In response, they've announced a new contingency fund that would provide the organization with sufficient cash to respond quickly and efficiently next time around.
With the support of member states, I am establishing a $100 million contingency fund, financed by flexible voluntary contributions, to ensure we have the necessary resources available to immediately mount an initial response. I am making the following 5 changes. I'm creating a unified WHO program for health emergencies, accountable to me. I'm establishing clear performance metrics for the program, built on partnerships with other responders. I am establishing a global health emergency workforce, and I'm strengthening our core and surge capacity of trained emergency response staff. I'm developing new business processes to facilitate a rapid and effective response. And I have proposed options for a new $100 million contingency fund.
The latest WHO summary, published on May 18th, said that there were at least 11,117 Ebola deaths in Guinea, Liberia and Sierra Leone, with more than 27,000 people said to have contracted it across the 3 countries. The Director General admitted responsibility for the organization's failure, saying the WHO had been overwhelmed.
I do not ever again want to see this organization faced with a situation it is not prepared, staffed, funded, or definitively set up to change and manage all these change.
And as I said, it is the buck stops with me. As a responsible leader, you need to learn the lessons and make the right changes.
Guinea and Sierra Leone reported 9 confirmed cases in the week to the 10th of May, the lowest weekly total this year, according to the WHO. However, Liberia became the first of the 3 hardest hit countries to be declared free of the virus this month, completing a 42-day period without a case. Matthew Edwards, CCTV.
But while Liberia's health is on the rise, for neighboring Sierra Leone and Guinea, the battle is ongoing. While CCTV's Robert Nagila is standing by in Freetown in Sierra Leone to give us an idea of the continuing efforts there. Robert, there have been flare-ups now in Sierra Leone and Guinea. What is the situation, though, in Sierra Leone a year on?
Well, thank you, Beatrice. Well, I spoke to the man in charge of the agency responsible for fighting Ebola in Sierra Leone. Now, he told me that as of Wednesday, they had 5 Ebola cases in treatment facilities around the country. However, in a further blow to that effort to fight Ebola, he says that 8 cases have been recorded this week alone. Now, this is after earlier this month, of course, you will recall that they'd gone about 8 days without recording any new cases, and there was a lot of hope then that they were on the right track. They still do believe that, but it's more of cautious optimism. Now, I can also tell you that just over 50 people are being monitored. These apparently came into contact with one of these Ebola cases that was confirmed. So they are being monitored to see if they will develop the virus itself. So cautious optimism, however, it's not over yet. This is now the critical stage. At this particular point, as we speak, Sierra Leone is now experiencing the rainy season. And this is a very dangerous period for the simple reason the virus actually thrives during the rains. So they are trying to make sure that they are on top of things here, trying to make sure that there's no further spread. And hopeful that within the next 2 or 3 months, if things go according to plan, that they will be declared Ebola-free, following in the footsteps of their neighbor Liberia. Beatrice?
All right, Robert Nagila, following the continuing efforts in the fight against Ebola from Sierra Leone. It's been a year on the Ebola front, and joining me now in our Nairobi studio to discuss this issue is Dr. Kizito Lubano. He is a disease control expert. Standing by in Nigeria is Professor Sunday Omilabu. He is a consultant virologist at the University of Lagos's College of Medicine. And in Geneva, we're also joined by the spokesperson for the World Health Organization, Dr. Margaret Harris. To you all, thank you for joining us here today. Dr. Lubano, to you first, though. The Ebola outbreak now seems to have stabilized. Liberia, Nigeria, Ebola-free, Sierra Leone and Guinea still having some Ebola there. Is Africa, though, now out of the woods?
Thank you for having me here today. I think we can all say that at least we have light at the end of the tunnel with the reducing number of cases, and we are definitely not out of the woods because Ebola hasn't been eradicated as such, but we are able now to say we have brought the epidemic under control because we have very few cases that are being reported, and definitely the efforts that have been put in place seem to have given the good result.
All right, Dr. Harris, though we are seeing light at the end of the tunnel there, but there have been some flare-ups in Guinea and Sierra Leone. What is going on there? What is it that the two countries are yet to get right?
Well, it's not really that. What's important to understand here is the job is not yet done. The countries are working very, very hard, but a lot of the elements that have been difficult throughout this outbreak, especially acceptance by people. You would say, but we've had Ebola for a year. Why are we still not getting it? But it goes from village to village to place. And over again, we see that people fear the consequences of going in and being treated more than they understand what a terrible thing it is to pass this disease on to other people. So they might stay at home rather than seek treatment. They may even beg their relatives not to tell people that they have it. We've seen this recently in one case. So getting people to understand, first of all, they must seek treatment because they have a much better chance of surviving if they do. And secondly, they must seek treatment because they must do everything they can to avoid infecting their friends, their family, everybody else in their community.
All right. Professor Omelabu, though, to you in Nigeria. Nigeria was among the first to be declared Ebola-free, though, now. And Liberia has also been declared Ebola-free recently. What has stood out, though, as the difference for you in fighting Ebola for countries like Nigeria and Liberia among its West African neighbors?
Yeah, thank you very much for this invitation. The Nigerian situation happened to use the already established systems, especially the disease tracking systems from polio eradication and the lead poisoning that we've had in the country. Actually helped greatly in stemming the Ebola outbreak in Nigeria down. Aside the fact that we were able to make the diagnosis very promptly, the Lagos state that happened to be the source of the index has a very well-established disease surveillance system. So all this helped us in putting together all experts, name them the epidemiologists, the infectious disease control specialists, the social scientists,
right.
All of us and the laboratory people, all of us put heads together to work in unison to fight the scourge. And we didn't live at the city level, house-to-house search. We also established the community search because this has to involve people. And those that were in contact were quickly established, and they were assessed, and they were cancelled, and they were monitored.
All right. Dr. Harris, if I can just come back to you, though. You've heard what it is that Nigeria did to ensure that the Ebola outbreak was eradicated there in a short span of time. Where is Sierra Leone and Guinea today?
Well, there's a very big difference, and I have to say Nigeria did a fantastic job. They really are a model of what you need to do, especially getting all those people on the ground right away. And they used what they'd learned with polio eradication, just as we've heard, and adapted that to what they needed to do with this Ebola outbreak. And we're learning from that as well. We're learning that we must have much greater capacity in every country to respond and have the kind of people that Nigeria had and mobilized there in country. It's not so much about getting internationals to come in, it's about the countries themselves being really good at this and then getting the support they need to do the job they want to do. So getting back to Sierra Leone and Guinea, their outbreaks had started long before they or anyone else realized that they had this problem on the ground. So they were a long way behind the curve. And honestly, they have done a very good job, but they are down to those last hard yards. And we have to stay with them, all of us. We have to give them maximum support right now. The biggest danger is the world thinks it's over and is moving on to other things. But now is a really crucial time when we have to help our brothers and sisters in those countries and help them get to zero.
We are going to talk about that support for Sierra Leone and Guinea in just a moment, but for now we'll take a short break. When we come back, we'll find out more about how Liberia beat Ebola. To stay with us.
It has been 3 years since our first bulletin, and from that standing start we've taken you across Africa and beyond. We've provided a voice for all Africans.
My dream for Africa is good education for all.
a platform for its people.
Come to Africa, make money, and help us develop our countries.
Trying to approach.
No one else takes you closer to the stories the world is talking about, or provides the images that will stay with you forever. This is an achievement that has won recognition from global leaders.
中央电视台非洲分台，他们奉行的理念是用非洲人的角度来看非洲，用非洲人的理念来解释非洲。
And all of this has just happened in 3 years. The best part is, we're just getting started. This is CCTV Africa, your African news channel.
The virus, in this case Ebola, has shown it time and time again how easy it is for a single cross-border traveler or a single unsafe burial to reignite transmission chains again. Our objective is get to zero, maintain zero, and early recovery of essential health services.
Well, that was the World Health Organization's Director General Margaret Chan speaking earlier this week. Welcome back to Talk Africa. We continue our discussion now. My guests in studio, disease control experts, Dr. Kizito Lubano in Nigeria, Professor Sunday Omelabu. He's a consultant virologist at the University of Lagos. And in Geneva, we're joined by the spokesperson, she's still with us here, of the World Health Organization, Dr. Margaret Harris. Dr. Lubano, to you first. You've heard that Margaret Chan there saying it has shown how easy it is for a single virus to reignite. But critically, though, has this outbreak, though, changed the way African countries will respond to such outbreaks in the future?
Yes, indeed. In fact, not only Africa, but the whole world. I think for the first time, we quickly realized that an epidemic that previously was neglected and thought to be confined to the rural folks, quickly, through the technology and globalization, went from Africa to the USA and to other places so fast. That is number one. So definitely there is a change in which it's going to be looked at, especially given the current renewed interest and a lot of research now taking place regarding the vaccine trials, the medicines, and also other personal protective equipment. The other thing that has been learned, how we are going to be handling epidemics, is that very clearly, if we look at the case of Nigeria and other places, we have seen what works, for whom, how, and what it costs or what it takes. Besides, when we see the prolonged delay in terms of bringing to control in Guinea and Sierra Leone, we also seem to understand that when you have weak systems, then it's going to take a bit much longer. So there are a lot of lessons that we have learned, and the way in which the world is going to respond is definitely changed, not only for Africa, but for the whole world as well.
And that change, though, has also affected the World Health Organization there, Dr. Harris, because there has been a lot of criticism about the particular handling of the Ebola crisis by the World Health Organization. How is the World Health Organization now going to be responding moving forward?
Well, we've all learned. In fact, we had a very interesting discussion session with MSF and other partners yesterday, and we've all learned that we did things that we would not want to have happen again. Particularly, as I was mentioning before, we did not work well enough with communities so that communities understood that what was being done was necessary and important, and that it was very much something the communities should want to do or would want to do. So now, yes, it's about Ebola, but it's also about the next infection. What this has taught us is that nature will come back, and there are many, many other infections in the animal world that can come into the human world. So we all have to be ready. It's like having a health defense force. We all have to be ready.
Well, we all have to be ready, but the Ebola outbreak did begin in 2013, and according to reports, though, it was declared by the World Health Organization as a public health emergency in August of 2014. I mean, many on the continent now ask if that outbreak had been in Europe, for instance, would the response from the World Health Organization have been different?
I do not think so at all. One of the things that would have been different is it would have been picked up much, much earlier. So yes, the first case was in December 2013, but as I'm sure you know well, the notification that there was a cluster of cases only came to the World Health Organization in March, the middle of March. That's 3 months of an infection burning and burning. Some of our partners did investigate the first cluster, but they thought it was cholera because that was the disease that was common at the time. So, yes, it was a different place and it was a place with different diseases. So perhaps in Europe or America, because the surveillance system is much sharper and they have the laboratory techniques to make that diagnosis earlier, certainly they probably would have picked it up earlier. But the other thing I think that's confusing people is public health emergency of international concern is actually a legal situation under the international health regulations. It's something that's declared by a committee. Actually, when we first notified the world of the outbreak, we went up to level 2 emergency, which is almost the highest level of emergency we have.
All right, we are monitoring Africa's response mechanism post-Ebola and after the World Health Organization technical briefing of the World Health Assembly earlier this week. Now, CCTV's Liu Xin spoke to the Liberia's Health Minister, Dr. Walter Gwenigale, to find out more about how they beat Ebola.
The number became so high because we did not know what to do in the beginning with respect to infection control and prevention. Also because we did not have the resources to handle this big problem. The reason that we were able now to handle this quickly because it was first the determination by our president that we had to set up a special unit just to deal with Ebola, nothing else. Second, it was because of the massive help that came. The Chinese, the Americans, when we had many more beds and we had many more ambulances, we didn't have people lying in the street. We could take them quickly to treatment centers. China has been with us for a long time. They are helping us in many ways. They were there preparing to do other things. Right now, they are doing additional work for us. They are helping to renovate the sports stadium that they built. They are getting ready to build a ministerial complex. I was the minister who asked them to build us a big hospital in Tapeta. And so they have done a great many things for us, for which we thank all of you people. Tell the Chinese people thank you.
When you look at the successes in key places like Lofa County, one of the worst hit areas at the beginning of this, they finally turned it around. When the local tribal leaders, the chiefs, the local imams, they took control of the response and they got educated on how you stop Ebola, what the disease was, and then they put those measures in place in their communities, and they explained it to their communities, they demystified it, and they helped them get the job finished. Many things contributed, but the keys were all Liberian.
You talked about international assistance, which has been very important during the fight so far. Could you share with us some of your impressions or your encounters with Chinese medical teams who have been operating in Sierra Leone, we know, and in Liberia as well? Are there any interesting moments that have left an impression on your mind?
One of the really exciting aspects of this crisis, actually, were the number of new major players who came to the assistance of these countries and these governments, and one of those was China. And it was interesting, as I worked in these countries, I came to know the Chinese ambassadors very, very well. They were very deeply involved in this and directly involved in helping to optimize the Chinese support. I've been to treatment centers that have been built by and run by the Chinese government. I met the Chinese military that helped bring in some of the supplies that were needed. These people are really impressive. They're very, very good. They played a key role in this outbreak. And I think what was wonderful about China's response was the breadth of it. It was materials. It was Ebola treatment centers. It was medical experts. It was public health experts, because you need all of that to beat Ebola. And China was very generous in bringing all of that to this fight.
All right, indeed. Dr. Lubano, still with us here in Nairobi, though. The World Health Organization criticism, though, has been one of the issues that has come out of this Ebola crisis, though. What's been the biggest lesson here that has been learned, both by the World Health Organization, both by Africa as well? Because earlier on, Dr. Harris talked about it is not more about what international assistance can come in, but what domestic institutions and domestic governments can do.
Yes, quite right indeed. In fact, the principle for any infectious disease control is the first line of defense is the local mechanisms and the first responders and the people who are dealing with any particular type of event, so to speak. So one of the things that need to be considered is that the issue of pointing fingers or blame game doesn't help anyone. The idea going forward is that, for example, in Africa, to strengthen the health systems, but specifically with regards to issues like emerging and other emerging infections like Ebola, cholera, and so on, is to have a robust epidemic intelligence system that both has put in place surveillance mechanisms based on events or indicators from the hospitals or any other health facilities, as well as a very clear monitoring and evaluation systems that obtains strategic information and is able to detect when there is a change within any particular type of population. So the first line of defense is the local people. As they say always, is the first person, unless the event is reported, it doesn't then maybe reach there. By the time we are reaching WHO, usually it should be that it's a notification and the first line defense systems have worked. One other thing that the African Union perhaps has been discussing and needs to happen is an equivalent of Centers for Disease Control modeled on the United States Centers for Disease Control that also is manned by the personnel who are specifically trained disease detectives called the Epidemic Intelligence Service officers that constantly collect information, right, both within the population and from other international neighboring institutions, and are able to have an early warning system that is able to detect any type of event that might lead to an epidemic or an epidemic as such. As a matter of fact, right now, all countries need to up their game because Ebola is still around. The reporting may have gone down, or we are getting used to it, so we are not so scared. But we need to continue being very vigilant and up our game in surveillance and monitoring. All right.
Dr. Harris, just to come back to the World Health Assembly that is going on this week, though, part of the World Health reform package there is to deal with performance benchmarks showing what must happen within 24 hours, 48 hours, and 72 hours, and not in months like we saw with the Ebola crisis, though. In terms of the reforms themselves that have been announced, what reform, though, is expected to have the biggest impact in the event of an epidemic?
Well, for us, one of the reform that's going to have the biggest impact probably is the fact that we're being made into a much nimbler force. So once, as we were talking before, you know, we would wait for notification, we would consider, but now we're moving into the people that get out there and start helping the countries. Still, as my colleagues have put so eloquently, the countries are the first line, and the countries are the ones who know what needs to be done. But we need to come in very quickly and provide them with the help that they need most at the time when it's needed most. And that's what the reforms aim to achieve.
All right, that's all we'll have time for this week. We'll leave it there on this edition of Talk Africa. Thank you very much to my guests for joining us. And thank you all for watching. To stay with us again next week for another edition. For now, goodbye.